Spill the Health, Real Talk, Real Health. Today we are very privileged to have our respiratory physician, Dr. Goh Kee San, together with us today. Hi, Doctor. Thank you very much for your time today.
Yeah, thank you.
Doctor, could you tell us a little bit on what a respiratory physician daily activities are? What do you do usually?
So basically, we are a specialized field. So as all doctors, they tend to specialize towards the end of their career. So for mine, I specialize into a field of respiratory, or another common term is called chest, where our common daily job is just to diagnose and treat conditions such as lung infection, cancer, any other lung inflammation, or anything that's related to lung.
Okay, so doctor, if let's say someone has a cough, okay, or flu, when should they see an ENT and when should they see you?
Basically, the strict definition of ENT and respiratory can be quite blurred because both involve airway. So one is the upper respiratory tract, and the chest or our respiratory involve a lower respiratory tract. So to strictly define this area is actually from above vocal cord down to the area of the lung is under us, whereas above the vocal cord down to the nostril is under ENT area. So cough can be anything from a nostril issue down to the lung below. So naturally, a lot of people with cough, they can see either ENT first or see me first. And most of the time, I do see ENT case and vice versa. So actually, the distinction for this is quite blurred. So most of the time, I also treat ENT issues such as nostril, sinus, and so on. Whereas lung, of course, sometimes ENT refer to me for those opposite situation.
I see. Okay, thank you so much, Doctor. So today we will be talking a little bit more about biopsy. So we realize that lung cancer cases, the incidence has been like quite high recently. I mean, due to like maybe lifestyle and also genetic issues. So PET-CT and both PET-CT and biopsy are basically the two very basic diagnostic thing that we need to do, especially for cancer part. So when we talk about biopsy, Doctor, I actually encountered a lot of patients. They are so afraid of biopsy. They always think that if let's say they do biopsy, if let's say they cut through some sample of the cancer part to be sent to the lab, they might be able to make the cancerous part become active. So, Doctor, probably do you want to explain to our audience on the internet what biopsy is and what is actually, why do we need to do this biopsy?
Yeah, to avoid this fear of doing biopsy, we first need to know what is biopsy all about.
Yes.
Right. So basically, it's a medical procedure that is important to extract or remove an abnormal cells or tissue from the body. So by what we call biopsy. So the sample is important to be examined by a pathologist under a microscopic examination through an investigation we call histopathological examination, or for short HPE. With this, then only we know the presence, whether there's a presence, the cause, or even the extent of the disease. For example, whether there's a presence of cancer cells, or rather than cancer, it can be infection or inflammations. So this histopathological examination is already considered a gold standard to confirm a disease. So without it, we will not be able to determine the nature of the disease, and hence we can't able to treat the disease properly.
I see. So definitely this biopsy is very, very important.
Yes.
Yeah, Doctor. Yeah. So talking about biopsy, what sort of ways that we can use to actually do this biopsy? Because in a lot of common perception of normal people, they will actually think that, okay, biopsy, then that means I need to do certain surgery and then I need to cut certain part of my my tissue and then send it to the lab. So is there only one way of doing it, or there's a lot of ways of doing it?
Yeah, nowadays there's a lot of options available for biopsy. We tend to now choose the one that is what we call minimally invasive, not like the surgery one. Surgery, of course, is more invasive. It requires general anesthesia most of the time, and hence leads to a lot of complications. So nowadays, we have a lot of options available under what we call minimally invasive procedures. So one of it, for example, is called CT-guided transthoracic or percutaneous lung biopsy, where if let's say the abnormal tissue is in the lung, we will choose this method, where the needle is guided usually under interventional radiologist, under CT guided, where the needle will be punctured through the chest wall into the area of interest in the lung. So this is one method. Another method, for example, is by bronchoscopy, where the scope, for example, is done by me, where the bronchoscopy is a long and flexible tube that's introduced through the airway. In order to reach the area of interest, typically that is situated inside the airway. So this is also minimally invasive. It doesn't require puncture except to when we want to extract the tissue of interest inside the airway. Then in a more specialized form is what we call EBUS TBNA. The full name is Endobronchial Ultrasound, Transbronchial Needle Aspiration or Needle Biopsy, where you also use a scope to guide the instrument down to the airway. But this time, rather than extract the abnormal tissue inside the airway, this one is can be used to extract the tissue or most of the time lymph node outside the airway. So this is usually reserved for those area that's difficult to reach deep inside our chest. So the other method, which is also done by me, is called pleuroscopy. Pleuroscopy is basically a procedure also using a scope, where the scope is introduced through a puncture through the chest wall inside the cavity where there's filled up with fluid in between the chest wall and the lung. So this pleuroscopy, apart from taking a biopsy, typically behind the chest wall, it also has the advantage of extracting fluid and hence at the same time able to relieve the symptom for the patient who is breathless, for example, due to the fluid itself. So these are all basically comes under minimally invasive procedure as compared to the traditional surgical method, which most of the time people fear most.
I see. So actually, there's a lot of ways of doing biopsy right now. So
Yeah, exactly.
So audience in front. So you now, from Dr. Goh's explanation, now you are. I feel that we are more educated now. So you guys don't need to be that scary. Okay, it's not so scary. So it's not just using normal open surgery and then cut it. So now it's minimally invasive,
Yes.
and now we have a lot of ways of doing it. So doctor, if you want to choose a biopsy method for a patient, what is your rationale of deciding which method of biopsy you will use for that certain particular patient?
So like the first one I mentioned, let's say is CT-guided transthoracic needle lung tissue biopsy. This one usually is reserved for those abnormal tissue that's located inside the lung. Then usually near the chest rib or the chest wall. Then the bronchoscopy will be reserved for those abnormal tissue that's inside the airway. EBUS TBNA, as mentioned, it will be reserved for those tissue that's located usually just outside the airway. And this one typically those located deep inside the chest wall. Pleuroscopy is reserved for those whose lesion or the abnormal tissue is not as above, but there's a presence of, for example, spread or abnormal tissue along the chest wall that leads to accumulation of fluid. Then pleuroscopy will be chosen.
Oh, I see. So basically, it depends on the location and also the condition of the patient, where the abnormal tissue is. So
Yes,
you choose
mainly
the different ones.
Is the location.
Yes.
Correct.
So doctor, if you compare all these four types of biopsy method, which one do you think is the more superior one?
Rather than more superior, all of it provide a quite high accuracy of diagnostic
I see.
tissue biopsy. So rather than choosing based on the accuracy, we typically choose based on the location and suitability.
Okay. All right. Thank you, doctor. So just now you talk about EBUS, like this EBUS. If we talk about this particular method, what are the advantage of EBUS if you compare that to these four types of biopsy?
So the main advantage of the EBUS is it can assess the area that is difficult to assess traditionally. So for example, there's an abnormal tissue or the presence of lymph nodes deep inside the chest wall. Deep inside the chest wall is an area where we call mediastinum, where it's packed with a lot of vital structure, such as the heart, large vessels, network of lymph nodes. So traditionally, we have to use a surgical method in order to access this area. We need to open the chest wall or cut, do an incision, usually under general anesthesia. But this time with the EBUS, it can be done under, for example, conscious sedation, where it already we can access into the abnormal tissue through the natural airway. We don't have to open up a chest wall. Patient doesn't go under general anesthesia. Hence, this procedure already provide a safer and provide a patient a much better recovery in terms of after the procedures.
I see. Thank you, doctor. So if let's say someone is going to do EBUS for the biopsy, what sort of preparations they need to do, and how long usually is the procedure?
So preparation will be, as any procedure, patient will be asked to fast, for example, for a certain duration of time, for example, 6 to 8 hours before the procedures. They will ask to withhold certain medications such as blood thinner in order to limit the risk of bleeding. Then they will just get prepared like any other scope or CT-guided biopsy procedures. So it can be done at the daycare, not necessary admission. So this procedure will take typically about 40 minutes to 1 hour under what we call conscious sedation. So even on waking up, it will be quite soon. Right after the procedure, they typically just rest for a few hours. Without any complication, they can usually go back on the same day.
I see. So basically, it's seems it's not so complicated. Yeah. So patient can actually go back to their house, go home on the same day after the procedures.
Yes.
Okay. So if let's say after they do the biopsy with the EBUS, usually what is next? What are the next steps?
So as all biopsy, after the procedure, then we have to wait for the results. So typically it takes about 1 to 2 weeks for the full report to be ready. So this is when we will determine which pathway of treatment they will receive. If let's say in terms of cancers, they will be referred to oncologists to determine the treatment. Whereas if let's say it's infection or inflammation, or let's say for example the patient is confirmed to have TB, it will come under me to receive the appropriate treatment and follow-up.
I see. So that's the reason why biopsy is so important, because without biopsy, it's very hard for doctors to actually determine what sort of treatment is suitable for that particular patient. So we thank Dr. Goh very much to explain to us about this biopsy. So doctor, if there's one take-home message that you like to let the audience know, what will that be?
Yeah, so most of the time public are worried of biopsy, or when they hear the words biopsy. And they also fear, like, for example, if the scope is being introduced into the airway. So I just want to assure that these advances in medical technology has been such that it minimizes any complications and any pain that can be experienced from a traditional surgical methods. So this, for example, EBUS or bronchoscopy doesn't involve any incision or cut. So, and just a typical sedation, a bit of sedation. The recovery will be quite fast, and after the procedure, patient usually can go home fast after that. So this shouldn't be a cause of worry for those patients who needs to undergo such investigation.
Okay, thank you very much, Dr. Goh, for your time today.
Yeah.
Spill the health, real talk, real health.